Hi, my name's Dr. Luke Smith. I'm a chiropractor and functional medicine practitioner. Now I wanted to talk to you about the link between chiropractic care and colic. Now colic is one of the most common things that we see infants for. Now colic is defined often by the rule of three. And the rule of three is that a baby will have a colicky scream for 3 hours for more than for three or more days a week for 3 or more weeks consistently. Now obviously a baby doesn't have to be 3 weeks old to have colic. They can have colic after 2 days, but they don't get that official definition until they've been crying for 3 hours a day for 3 days a week for 3 weeks. Now my take on colic is due to my experience seeing colicky infants. And my take on colic is that these kids are in pain. Now the origin of the pain varies. Very commonly the pain is coming from the neck. The other area they may be experiencing pain from is discomfort with their digestive system, either a burny, refluxy feeling or a windy feeling in their stomach or digestive system, or another digestive complaint such as gasiness or constipation or bloating. Now, why do these conditions occur in such young infants? Now, for the neck pain, it's much the same problem quite often as it is for the digestive pain. So let me explain. Now, quite often these colicky kids have had a very traumatic birth experience. Either the birth was assisted with a vacuum extraction or a C-section or forceps, or sometimes it's a very quick birth where they've been forced out a little quicker than may have been ideal. But either way, you often get in the history of these kids that it was quite a difficult entry into the world. Now, what can happen in a difficult birth process is it can be very traumatic for the neck, because the neck from the head is what comes out first, and often the head and the neck will get twisted and pulled and turned, and this can really upset the neck. And the way it upsets the neck is the alignment of the joints in the spine can become subluxated. Now, subluxation means that the joints are out of alignment, the nerves are interfered with, and this can be very painful for a child. The other thing that can happen is, and how it might affect the digestive system, is a lot of the nerves from around the C1, C2 area form a nerve called the vagus nerve. Now the vagus nerve has a huge control over the digestive system, particularly the esophagus, the stomach and the intestines. Now if you have a lot of irritation around the joints at the top of the neck and inflammation, it can actually irritate the vagus nerve enough that it will stop normal digestive systems happening. And in a baby, in an infant who's only a few hours or days or weeks old, they've got very sensitive digestive systems. So any upset to that digestive system can make it very difficult for them to have a normal digestion. And that can result in reflux or wind or constipation. So the chiropractic approach and the approach that I take with babies with colic is always check the neck and the alignment of the neck first. If there's anything out of place, we adjust that to alleviate the irritation to the nerves and make it much more comfortable. And very often, within 1, 2, 3, 4 adjustments, this is enough. And the child is far more comfortable and they're able to feed better, they're able to eat better, digest better. They're no longer colicky babies. This is an ideal situation. Sometimes it takes a little bit longer. And when it takes a little bit longer, we're normally dealing with not only subluxation issues with the neck, but also food sensitivity issues. And this may be that the formula is reacting that they're taking if they're not being breastfed. If they are being breastfed, it's to do with the mother's diet. So we have to look at all these factors if we're looking to correct the symptoms of a baby who has a lot of colicky issues. But it's certainly, if you do have a baby that you know, or your own baby who's suffering with colic, it's an awful condition that can really have a dramatic effect on the family. And I really encourage you to find a chiropractor who's experienced seeing kids who have this condition, and allow them to check the baby, especially their neck, make sure that's all okay. And just remember that creating health for you and your family and your kids is a choice. It doesn't happen by chance.